Good afternoon, everybody. Thank you very much for coming to NHS Grampian's annual review. My gratitude to everybody that has been involved in today's sessions between the clinical forum, the partnership forum, patients, private session that I've had with the Chair and Chief Executive. For the avoidance of doubt, my name is Neil Gray. I am the Scottish Government Cabinet Secretary for Health and Social Care. I'm joined from a government perspective by Christine McLaughlin, our Chief Operating Officer and Deputy Chief Executive of NHS Scotland. Also with me is Stephen Gallagher, who's the Chair of the Government's Assurance Board for NHS Grampian's escalation. And from NHS Grampian's perspective, we have Alison Everson, the Board Chair, and Laura Scaife-Knight, the Chief Executive. The annual review is an opportunity for us to scrutinise the work that has been conducted, in this case, by NHS Grampian over the preceding year, to analyse their performance against key areas of metric, as well as to hear directly from staff, from patients, as to the operation that has been conducted over the previous year. And it is an important assurance process for the government and also for the public, very publicly as demonstrated here, to hold the board, in this case Grampian, to account over decisions that have been made, the performance that has been delivered for the investment that's been made by the public. In terms of the format for the discussions here this afternoon, I will shortly hand over to the Board Chair, who will undertake a presentation on these key areas of performance. I'll then ask for any questions in a question and answer session. I should remind colleagues that any personal patient-related information should be conducted in the normal way and processes, and I would encourage colleagues not to share confidential patient information in this forum. There are opportunities, as has been explored by patient groups previous to this in a more private session, to be able to share those experiences and make sure that they're brought to the board's attention and to government's attention. But it obviously wouldn't be appropriate to answer questions about patient-specific issues in public. And I will then field those questions, either if it's a question for government, myself, or Christine will answer. If it's clearly for NHS Grampian, I'll ask Laura and Alison to, alongside colleagues that are here across NHS Grampian, to be able to respond to those questions as appropriate. There is no ability for colleagues that are attending the session online to be able to ask a question in real time, but the board has offered the opportunity to lodge a question in advance, and I understand that there are some of those to come forward during the question and answer session. And then at the conclusion of this process, a formal letter will go to NHS Grampian and be available publicly to summarise what has been discussed over the course of today. So thank you very much indeed in advance for everybody being here today, for ensuring that the board annual review can happen in the way that it does, ensuring that information is coming to the fore to test against the board's presentation that we're just about to hear, and ensure that government, as I say, and the public can hold the board accountable for the spending of public money. So I'll now ask Alison Everson to take us through the board presentation. Please, Alison.
Thank you, Minister, and welcome to everyone from us as well. As you've heard, I'm Alison Everson. I'm Chair of NHS Grampian's board, and I'm delighted that you've all been able to join us this afternoon in Aberdeen for this year's annual review. This public part of our annual review is being recorded so we can share on our website for those unable to attend. This short presentation will be an overview of some of our achievements and challenges from 24 to 25, and a look ahead to the improvement work already underway. NHS Grampian's financial and performance challenges in the last year are well known, and I will speak more about the improvements underway to address them shortly. Our achievements are, however, also notable. Our hard-working colleagues provide high-quality, person-centred care to hundreds of thousands of patients a year. The numbers showing some of that activity for our key patient groups are given on this slide. Acting on patient feedback, both positive and negative, is essential for delivering high-quality, safe patient care. Some aspects of this activity are on this slide. Care Opinion provides really valuable insight into how feedback can lead directly to improvements. By way of example, recent complaints about waiting times have led to critical machinery being repaired and to improved processes to contact patients by telephone to provide them with up-to-date information. The next slide shows how NHS Grampian performs in the key national indicators for timely access to care. Our performance is not what anyone wants to provide for our population. We know that behind all of these figures are individuals and their families being impacted by their waits. We must continue to do more to fundamentally transform our health system to improve timely access to care. We have been working collaboratively across Scotland to support the development of this. There has also been very welcome support from the Scottish Government and from other boards to review our plans for unscheduled care and planned care and to share learning from other parts of Scotland. This slide shows some key points related to NHS Grampian's finances. NHS Grampian reported a deficit of £65 million for the 2024-25 financial year and obtained brokerage from the Scottish Government to cover this. This took the total brokerage received by NHS Grampian to £90 million. NHS Grampian delivered £50.5 million of savings in 24-25, including £25 million of recurring savings, and exceeded the 3% recurring savings target. This was one of the highest levels of recurring savings against budget delivered by any Scottish Health Board. This still left a huge deficit of £65 million, which requires more radical savings plans to be delivered this year to create medium and long-term financial stability. The actions required to make savings must be balanced against minimising the impact on clinical safety and on patient care, on staff experience and prevention work. All of these things are part of our finding balance approach. As chair of the NHS Grampian Board, I am determined that our health and care system will make rapid improvements to how the people of Grampian access unscheduled care. Our ambulance waiting times and our long wait in emergency departments provide a very poor experience for patients and undermine confidence in our system. It will take time to implement our whole system unscheduled care plan, on which we are working collaboratively with our IJB colleagues. And the £9.2 million additional funding from the Scottish Government is very welcome. Our senior managers are focused on taking urgent steps to enhance safety and to lower clinical risk. I must stress the intense activity underway across the system to improve our performance and to also improve our patients' experience. For planned care, we are delivering costed plans to significantly reduce the number of patients waiting for more than 52 weeks for a new outpatient appointment or inpatient treatment by March 2026. On current trajectories, the number of outpatients waiting over 52 weeks will reduce from 10,038 to 5,489, and treatment time guarantee numbers will reduce from 3,671 patients to 3,498 by the end of March 2026. We are pursuing opportunities for mutual aid from other boards to further reduce the number of TTG patients. And we are also seeking additional funding to reduce these numbers even further. We will submit revised trajectories for the outpatient and time to treat guarantee numbers to Scottish Government very soon. These trajectories will take account of the impact of the downtime from our central decontamination unit, any additional funding received, and the agreed levels of mutual aid from other boards. New national arrangements to support requests for mutual aid will help NHS Grampian reduce the waiting lists further in future years. NHS Grampian also stands ready to support other boards with aid in specialities where we can. An external review of planned care recently highlighted areas of good practice. It also made recommendations for further efficiency improvements, which are now being implemented. Scottish Government confirmed in March 2025 that the maximum permitted overspend for NHS Grampian in 25-26 is £45 million. Achieving this requires £62 million of savings to be delivered, including the delivery of at least 3% of recurring savings against budget. We are aware we will need to continue this focus on delivering recurring savings for several more years. This slide shows that we are on target this year to deliver both the savings target and the level of recurring savings required. The board is very alert to the seriousness of our financial position. We have improved our financial reporting with greater transparency in the papers available on our board web pages in advance of every meeting. We have also new financial governance arrangements to oversee delivery of the savings plan and monitor the finding balance elements. These arrangements include a financial recovery board chaired by a non-executive board member. The 3 health and social care partnerships within NHS Grampian are also facing financial pressure. Contributions of £22 million were required from NHS Grampian in 24-25 to cover overspends within the 3 partnerships. We continue to work closely with partners to address together the challenges faced within health and social care. An example of this being a recent integrated service and financial planning workshop attended by senior representatives from across our system. Feedback from colleagues is also essential. iMatter is the NHS Scotland staff survey, and NHS Grampian's 2025 results are in line with those of other boards, as you can see from this slide. Staff well-being and a positive working environment are critical to delivering high-quality care. We value diversity and inclusion in the workplace and have a vibrant, empowered, multicultural staff group, GEMS, and a new neurodiversity staff group. We are also introducing improvements to our whistleblowing processes and a culture programme board, which will provide greater focus to improve leadership, staff engagement, and create psychological safety. NHS Grampian staff deliver high-quality care to thousands of patients every day, supported by many colleagues whose work is less visible but no less essential. I and my fellow board members are very proud of all that they do. The organisation was escalated due to concerns about our financial performance, plus concerns about leadership and governance. The external diagnostic review commissioned by the Scottish Government in early summer 25 examined these issues, and the recommendations provide a welcome framework to refocus on improvement work and to build on our strengths. The review confirmed that NHS Grampian has not overlooked any obvious opportunities for efficiency and saving money. Rather, it emphasises that we must transform how we deliver services to improve both care and financial performance. Our single organisational improvement plan is critical to delivering the transformational change required. The NHS Grampian Board will consider a detailed paper describing the improvement plan at its meeting next week. There are 96 recommendations, work on many of which has already been completed or is underway. One of the key recommendations from the external review was that NHS Grampian focus on fewer priorities to improve areas of unacceptable performance. Now turning to our infrastructure, which has been in the news recently with the problems in our central decontamination unit. This was highlighted as a high risk at last year's annual review. There was a serious failure of equipment at the beginning of October, which required shutdown in order to protect patient safety and allow new equipment to be installed. Our CDU staff and the team supporting them have gone above and beyond to continue production at our other unit at Wood End to allow emergency, urgent and cancer care to continue, and have been willing to work away from home to provide a service. We have also had tremendous support from other boards in reprocessing our surgical kits. New machines are being installed and we expect to return to full capacity in early January. Some of our other infrastructure detailed on the slide is high risk too. The issues at the Blair unit are being addressed with a £2 million refurbishment project underway. Much of this presentation has focused on our current actions to address our immediate challenges. The external diagnostic report emphasised the need for transformational change at the same time. This is recognised as an issue for NHS Scotland, not just for NHS Grampian. The Scottish Government's Population Health Framework, published in the summer, recognises that in order to have a sustainable health and care system for our future generations, we must be more focused as a nation on prevention and shifting the balance of care away from expensive hospitals into our communities. As you can see from this slide, NHS Grampian has already been very active in this area. We have developed a route map for strategic change which supports shifting the balance of care to communities. We are also working with partners across boundaries, disciplines and sectors, and with communities who are experiencing disadvantage and poor health, to achieve a fair and vibrant society where all individuals and all communities can flourish. A prime example of how taking a different approach can deliver tangible change is our Putting People First work. This is being funded for 2 years by the NHS Grampian charity and is truly transformative in how we seek input on our priorities and services from the communities we serve. Some of the initiatives underway are listed on this slide, and we have some people here today with positive experience of our community appointment days. I'm really very excited by the potential of this work to help us deliver the transformational change I have referred to so often in this presentation. Finally, I come back again to our most important asset, our colleagues across the system, working so hard day in and day out to deliver exceptional care to our fellow citizens. Rather than list their achievements, I'm very glad to be able to finish this presentation by showing a short compilation of some of the news headlines from last year showcasing their successes. As you will see, these are diverse, from astounding clinical world firsts, such as the removal of a large brain tumour through the eyebrow, to national awards for being the best in class for their role. Before we play the brief film, I would like to put on record again my thanks and the thanks of my fellow board members for all that NHS Grampians staff do. After the short film, Mr. Gray will take us through the question and answer session. Thank you very much. Thank you.
Thank you very much indeed, Alison, and thank you to colleagues who have pulled that compilation together. I think there is an important thread that runs through Alison's contribution there. She started and finished with it, which is our thanks to our staff for the work that they do across the health and social care services here in Grampian, and it's an important point to re-emphasise as Cabinet Secretary my thanks to all staff for the work that they are doing, sometimes in very challenging environments, which I have recognised in the visits that I've made, but always seeking to do their very best for the patients that they are seeking to serve. So we'll now move over to the question and answer session. I'll start with some of the questions we have received in advance, and then I will take a show of hands from the floor if should anybody wish to build on these or to ask any further questions. The first is about the board's waiting list for those seeking assessment and potential treatment for ADHD, noting that only one of the 3 local IJBs has service provision for ADHD, and asks how this position will be improved over the next year. I'll hand over the board team to respond.
Thank you, Cabinet Secretary, and good afternoon, everyone. It's good to see so many people joining us here today. So thank you for the question, first of all. I think as an organisation and a system, we absolutely recognise that we need to both review and redesign our neurodevelopmental pathways across Grampian. And if I may, I'd like to give a Grampian-wide response to this question, because I think that's really important, and invite our 3 Integration Joint Board Chief Officers up to the front, please, to answer that question, so we can, as I say, give that pan-Grampian response, which I think is hugely important. Thanks all.
Good afternoon. So my name is Lee Jolly. I'm the Chief Officer for Aberdeenshire Health and Social Care Partnership, and we are probably one of the slightly uniker of the 3 partnerships, because we do not currently have a pathway to diagnosis for ADHD or autism, and that was a decision taken by our IJB back in February 2025 as a result of some of the financial pressures that we were experiencing. However, we do recognise the impact that this has on our communities and the need for support and therefore the support that we provide across Aberdeenshire does not rely on a diagnosis. So if someone is struggling with their mental health, with the symptoms that they experience as a result of potential ADHD or autism, we are still here to offer a service and support as required to those individuals. However, at this point, we're unable to progress a formal diagnosis for adults. For children, there's a very different pathway, and I think one of my colleagues is going to pick up on that in more detail. Thank you.
Good afternoon, everyone. I'm Judith Proctor, and I'm the Chief Officer for the Moray Integration Joint Board. There are no current formal pathways in Moray for adults seeking a diagnosis of ADHD if they don't already have a comorbid diagnosis of mental health problems. And we recognise that this is a very difficult position for people in our community. And whilst we're working very hard on that, we're working across primary care with our GPs to work with them and our mental health services to see if we can indeed create a pathway and thresholds whereby people who don't have a mental health diagnosis can access support for their ADHD. Initial discussions have focused with our general practice and they will continue in coming months. It is quite challenging, I think, as Lee's described, because we are seeing quite an increase in demand for a diagnosis against very limited resources to be able to put anything in place, but we are taking forward those discussions. In terms of adults with autism, we do have a pathway very similar to Aberdeen, and I think maybe Fiona will pick that one up, so thank you.
Good afternoon, I'm Fiona, I'm Aberdeen City Health and Social Care Partnerships Chief Officer. And as Judith alluded to there, we do have an assessment team in Aberdeen that covers Aberdeen and Moray. The waits are extensive for that service, but there is there, and the majority of people that actually come into that service self-refer. So what we are doing is we work closely with them for that post-diagnostic support, but also some signposting in the short term to have opportunities to see what they can do to self-manage and self-care for themselves. So that processes are there. We're also working with educational psychology at the minute in Aberdeen City. We're looking to do something different for children, to really look at the pathway that we have and is there something else that we can be doing differently. So I think that's quite a novel and new approach for us to be really trying to join that teams up together to make sure that we are giving that support to people as we need. There's also a charity bid that we got recently where we're working with Combined Child Health, so Geraldine's part of the system, and how we're trying to look at our referral pathways and see if we can just make them better, smoother and more effective and efficient for the people that are out there. Thank you.
Thank you very much indeed, colleagues. It's very helpful. The next set of questions are from a public representative on the Local Health and Transport Action Plan Steering Group. The representative notes that the most common concerns raised with them are about patient access to healthcare, particularly at the ARI. And the first question asks, is the board considering improvements to the drop-off arrangements for members of the public for those with disabilities and health conditions? That's something that came through the patient forum discussions that I had earlier as well. So this question is pertinent to colleagues that were part of the patient discussions. And the second question asks whether NHS Grampian has applied for any external funding to make local access or transport improvements. The third question asks, how does the board's did not attend figures compare nationally?
Thank you very much. I think, as you say, I think access and accessibility to our sites, especially the Aberdeen Royal Infirmary, has certainly been a theme throughout the course of today. And I think we recognise it's an area we absolutely must do better and make further improvements, because fundamentally it has an impact on the overall experience of our patients, their families and carers, as we've heard throughout the course of today. So if I could ask Alan Wilson, our Director of Infrastructure, Sustainability and Support Services, I'm sure will take these questions in the rounds. Thank you.
Hi there. Thank you. Sorry, I've got a sore throat today, so please bear with me. So yeah, in regards to the RI site especially, it's been really congested, as you can imagine, given the amount of construction work that's been going on. And obviously we've got a couple of mobile units that are on as well. So again, it's getting that balance right. And I have seen it firsthand, the difficulties that some people have been accessing the facilities. So to say that we are now undertaking our annual risk assessment of the site, looking at workplace transport, dropping people off, see if there's better opportunities for us. So once we do that, hopefully we can see some opportunities. But again, it's probably not as much as we'd like to do given the constraints that we're currently under. But if you look at some of the work that we've managed to do, I think hopefully it helps with access there. Secondly, in regard to funding, so we've got access to funding. I think it's £50,000 this year from capital. So that comes directly from Scottish Government for capital for any DDA work. So that would then be the source of money that we could get. And we also work with people like Nestrans and that, which can have an opportunity to allow us to advance there. The key bit of though is obviously, like any main hospital site, is the car parking. So prior to COVID, we had a car parking strategy which used the number plate recognition. It was turned off because it was felt it wasn't needed. We've now just redone that strategy. We'll be putting it back out there, and that will not only help with the movement of cars, but also we've looked at the strategy and how we strengthen where we're able to challenge people who are not parking appropriately. So again, hopefully that helps access coming on site. And I think the last one is quite hard to come out with about the people that are missing appointments and that. But just to say that within Grampian, we're sitting at about 10%, and we're sitting probably at the top half of Scotland, but we couldn't put any figures against people not being able to attend due to the fact that they're not getting parked appropriately and they've got a disablement. So hopefully that answers the question.
Thanks very much. It's maybe something for us to drill further into in understanding patient experience as to whether or not some of those did not attend figures do relate to some of those accessibility issues, not just for the those that are coming to ERI locally, but also recognising that there's quite a geographic spread of services across Grampian right into Murray. So it's another very important area. The next set of questions are linked and are about disabled access to Aberdeen Royal Infirmary. The first notes that the lift at the Alan Downey unit has been out of action for a number of years and asks when it will be repaired. The questioner also states that they are entitled to help with healthcare costs, so can be refunded travel costs, but they can't travel by public bus if they're using their powered wheelchair, so community transport is the only option and it costs more than the public bus. So asking why they can't be refunded for the cost of community transport. And finally, the person asks why the NHS can't provide tickets in advance to avoid patients having to pay up front and then claim back. Again, local transport and planning provision is for the board to answer, so I'll hand over to Laura.
Thank you. So I think it's fair to say there's some emerging themes that we'll just keep coming back to. We've heard a lot about accessibility and access, but I think our ageing estate and the risks associated with our infrastructure in the organisation is another really clear theme that we will keep returning to. And I think this is right at the heart of this, a very, very precise case study in terms of a lift that's gone out of action, taking an unacceptably long time to be prepared and a number of years in this instance. And because of the impact on patients this clearly has, I'm going to ask Dr. Hugh Bishop, our Executive Medical Director, to cover these questions. Thanks, Hugh.
Thank you, Laura. I'm Hugh Farrow-Bishop. I'm the Executive Medical Director. In terms of the timeline to the repairing of the lift, I'll work with Alan offline for us to try and understand and expedite that if we possibly can. We have explored the costings and the reimbursement around travel and some of the issue that's described, and I'm going to be careful to follow the instruction not to get into individual patient details, but some of the issues pertain to the way that the contractual arrangement is around reimbursement of travel. So, for example, there is a defined rate that is reimbursed on a mileage basis for travelling using one's own vehicle, and the cost of community-based transport is slightly higher than that reimbursement rate. In terms of the pre-booking of transport, it is possible for our team to book train travel in advance on behalf of a patient, but the nature of the contracting doesn't allow them to do that through, I think it was the Stagecoach app that was mentioned in the particular question. So unfortunately that is not possible. We would of course be keen to have dialogue with any individual patient that is affected by the implications of those contractual arrangements, and if there is anything that we can do differently, then we will seek to do that, but hopefully that gives an understanding of the reasoning behind the situation described.
Thank you very much indeed, Hugh. The next question, the next two questions actually relate to vaccinations. I'll take them in turn. The first is about the costs of administering the local vaccination programmes, asking the board to confirm the cost per vaccine delivered under the vaccination transformation programme compared with the historic cost of delivery undertaken by GP practices. Now, this might be one that needs to be followed up in writing, given the detail of it, but I don't know if, Laura, you have anything that you'd want to say on this part before we perhaps get more detail on that in the public letter that I'm able to share.
Thank you very much. So firstly, I just really want to say that take-up of vaccinations this winter, both flu vaccination and COVID, is an absolute top priority for us at NHS Grampian and every other health board across Scotland, because this is a central part of our winter plan, and it's about keeping each other safe this winter. So an unashamed plug to please get your vaccinations if you haven't yet done so, because this is about safety and looking after ourselves, our patients, our loved ones and one another. I'd like to just invite Shantini Paranjothi, our Director of Public Health, to answer the specific questions around vaccinations. Thanks, Shantini.
Thank you, and thank you for the question. So I'm Shantini Paranjothi, Director of Public Health. So the question is about our model for providing vaccinations, and in Grampian this is very much based on the national policy direction, and we've developed the model in consultation with general practice and with the Scottish Vaccination and Immunisation Programme. Now, whilst we don't hold comparative data that allows us to answer the question directly, what I can say is that for 2024 to 2025, the cost of delivering the vaccination program, which has come from the Primary Care Improvement Fund, which I think is what the question was about, was £3.2 million. And we publish our performance of the vaccination program. That's done every year through our annual report. And our annual report for 24-25 will be published in January next year.
Thank you very much. If you could stay, because I gather you'll probably end up answering this next question as well. And like Laura, can I just underline one of the best ways of us to look after ourselves, each other, the health service at this time of year is for staff, for patients, everybody, if you're eligible, particularly for the flu, but also RSV programmes, to make sure that you're picking them up, and the child vaccination programmes. Make sure that those are being enabled and supported. And that takes me to the accessibility of them, which is the final question that we've received in advance, is about local access to the winter vaccination programme. The person lives in Edzell and is offered vaccination appointments in Bankery or Stonehaven, to which there are limited or no bus services. They live in Montrose, they live only 15 minutes, 15 miles from Montrose, and will ask whether the vaccination appointments could be delivered there instead.
Thank you. So again, really appreciate the question. We also appreciate the difficulty during winter with, getting to vaccination centres, particularly with unpredictable roads and limited transport options in rural areas. Accessibility is very important to Grampian and also how we deliver our vaccination programme. However, we recognise that, sometimes the options that we have may not meet the needs of some people in some rural areas. So in general, appointments are based on your address and our network of vaccination centres. We do have the option to call in or phone up and either reschedule your appointment or also change the location, but we appreciate for Edsel Woods the options that we have in Banbury and Stonehaven may not be the easiest to get to. So in order to try and respond and increase accessibility, what we will be doing during December is pop-up clinics in Lawrence Kirk, Inverbervie and Auchenblair. And this hopefully will increase accessibility for people to access vaccination services. There is also a clinic in a vaccination centre in Montrose that's run by NHS Tayside, and it's possible to reschedule and book an appointment in this clinic through the National Contact Centre. We really value our partnership arrangements and working with other boards, and we're constantly reviewing opportunities to strengthen those partnership arrangements. And we're certainly working on a program where we can look to review and increase our accessibility to vaccination centres going forward.
Thank you very much indeed. A critical area at this time of year, so I'm very pleased about the work that's been done there. We now have about 10 minutes for spontaneous questions from the floor, if there are any. If you could indicate if you have a question in the usual way by putting your hand up. I'm seeing one eager party. I was going to say I'm not seeing an eagerness as yet. I'll get a microphone to you, allow the question to be taken. If you could say who you are and where your question is to be directed, please. Yes, if you pop it up. Yeah, it's on. It's on.
It's on.
Yes.
Jolly good. I'm Michael Morgan. I'm a community councillor, and in that role I've spoken to a number of people about their feelings about NHS Grampian. It comes into two groups. There are those that have been treated and they say treatment is absolutely excellent, the care is absolutely excellent. And there are those who are left waiting. And some of those are left waiting to get a GP appointment, which is disastrous as far as they're concerned. The point I want to raise is that NHS Grampian's board have lacked leadership, they've lacked direction, they've lacked focus, and they've been escalated to stage 4, and that has come with a review that has pointed out lots of failings. So my question is to the Scottish Government, when are you going to escalate to stage 5?
Thank you very much indeed, Mr Morgan. There are some areas there that are for government, and I'll ask Laura to respond on her behalf for Grampian as well. First of all, on access to general practice, we have recognised that there are funding pressures within general practice, and there are capacity pressures, huge level of demand upon general practice, and we want to move to a more preventative, community-based model of care. That's the policy agenda for the government, is moving more into community care. That's the shifting of the balance of care from hospital into the community. We've come forward with an agreement with our GP colleagues for an increase in funding over the next 3 years of £530 million, which is front-loaded to increase the number of GPs being employed within general practice and to increase accessibility. However, since COVID, there has been a gradual and increasing level of interaction with general practice. So that has been improving. There is more to do, which is where the funding is directed towards. In terms of people that are waiting for appointments and procedures, this has been the focus of much of the discussion that I've had with the Chief Executive and the Chair, and has been part of the discussion with the various forums that I've had the pleasure of meeting with this morning. I believe that in many areas we are turning a corner. We are starting to see performance improvement, not just in Grampian, but across Scotland, because of the intensity of focus and the funding that's been provided, and the incredible work of our staff to see activity rates rise and the number of waits falling. There is still more work to do. The reason that NHS Grampian were escalated, as the Chair pointed out, was because of governance, leadership and their financial performance. There is an assurance board in place. Should that not give the necessary assurance, there is another level to go to. I think it is too early to say that that is required at this stage. I believe that the Assurance Board process is doing what it needs to. It's finding the challenges, seeking to address them and having a plan to address them. But this is something that is gathering quite a significant amount of attention of government to ensure the performance improvement happens within Grampian.
Thank you.
Thank you. And I think you rightly highlight the inconsistency of experience our patients have, and that's something that we need to turn our attention to, so there is a more positive experience for patients more often across all of our services rather than in pockets as we see today. In terms of leadership and focus, I think the leadership and focus of this board is now crystal clear. Sadly, perhaps going into level 4 has refocused our minds, but in terms of the priorities of the organisation, they are, as I say, crystal clear: improving unscheduled care, planned care, and our financial performance. And whilst we have some distance to go in all of those areas, there is, it's fair to say, green shoots. So if we look at our performance for this year, we are on track to achieve our financial and savings plan, though that is not without risk for the remainder of the year. But as of month 7, we are on track to achieve that plan. In terms of planned care, notwithstanding the challenge we've had with the shutdown of our central decontamination unit in recent weeks and months, we are on track to achieve the trajectories that we've agreed with Scottish Government. And I am in no way shying away from the fact that we have some way to go in terms of improving unscheduled care performance, and that remains the focus, not just for NHS Grampian, but across the entire system, because our patients deserve a much better experience than they're currently receiving. So that remains an absolute laser-like focus for us all, so we can start to see improvements. We have a health system improvement plan that requires some recruitment that is underway, because it includes investing in community capacity, but there are things we must do internally to, again, going back to that consistency word, especially around discharge experience, discharge practice across our hospitals. There are things within our gift that we can do to make improvements. So that remains a key area of focus. It will do beyond this financial year, but I think it's fair to say there are green shoots, but we need to remain focused across the organisation and system to deliver the plans that we have set out, and moving beyond talking about plans to actually getting results and those plans coming to fruition. And on that note, we have very clear governance, strengthened governance in the organisation now around those 3 priority areas. We have programme boards that have been stood up so that colleagues can be held to account. We know where we are against the trajectories that we've set out. So if we go off track, we know we are going off track, but most importantly, what we're doing about things to bring things back online. Thank you.
Thank you, Mr. Morgan. Another question I was indicated here, and then I think that's all the questions which would, we've got one brief question here, one brief question at the back, and then that would probably bring us to time. If we could be brief, say who we are, where we're from, and the question, and then we can answer them as best as possible.
Thank you. My name is Prasanna Gautam. I used to be a former physician here at ARI and Woodend. Just to clarify, did I hear correctly that the planned care aim is 52 weeks for any new referral? Is that what is the aim of the...
The national policy is for us to get to 0 weights
that's what I meant.
At 52 weeks.
So does that mean, paraphrase, that we can expect to get our appointments at least within a year?
That is the policy, that is the plan, that is the objective that government has set, that is what we're working with boards in order to achieve, and to ensure that we are reducing the longest waits. We've made substantial progress on that already. We are seeing 5 months in a row of improvements on 52-week waits, but there is still more work to do as has been set out. Colleague up at the back, please. Thank you.
Thank you. Cabinet Secretary, thank you for organising this meeting and giving us the opportunity to attend, and thank you to Alison for her open presentation on NHS Grampian. We appreciate it. Frank Musgrave, I represent Benahee Community Council. After the major incident in ARI in November 2024 where ambulances were stacked outside ARI. The Press and Journal reported that you said, the important element now is making sure all possible capacity, not just within ARI, but within NHS Grampian. All possible beds are being utilised. The way to reduce pressure on ARI is to improve care home and community hospital capacity so that inpatients can be discharged in a timely fashion, and to adequately resource GP practices to reduce unnecessary ARI attendance. Can you confirm that the funding will be provided to achieve that?
Thank you. Yes, that formed part of my statement that I gave to Parliament earlier last month, setting out the redirection of £20 million of resource going into social care in order to support the social care capacity for the pressures of winter. I've also already set out in response to Mr Morgan the investment that's coming into general practice. There was increased investment this year, part of a stabilisation and GP recruitment and retention investment of £15 million that followed over £13.5 million that went into general practice last year, and now over the coming 3 years, subject to parliamentary budget processes, there'll be £530 million going into general practice, because that shifting of the balance of care that I spoke about in response to Mr Morgan is the route through which we address the unsustainable capacity demands that are being placed on our acute system, which is what drove the challenge that was seen at the ARI last year. So I hope that helps to address your question.
Thank you. If I could ask a follow-up, please. The Press and Journal has also reported that NHS Grampian has been underfunded by £262 million over the last 15 years compared to other regions in Scotland. Does what you've just said mean that you're confirming that this underfunding will be rectified?
So the position with regards to the funding of Grampian is the same funding formula that is used for all boards. It's the NRAC formula, which takes account of the service capacity and demands upon each board, as well as the need to deliver services in rural areas, for instance, which obviously cost more. NHS Grampian is a similar distance from NRAC parity, I think 0.5 or 0.6% as other boards in the country, and that has been the case for a long period of time. So the fair and equitable distribution of funding is present. The conversation that we had with the partnership forum earlier focused on this point, and there was an acceptance that everything possible needs to be done within Grampian to ensure that every penny and pound is being spent as efficiently and productively as possible, and then for there to be, if required, a further conversation as to whether there's more that would be required. I should say, in addition to that, that as part of the work that's been carried out through the Assurance Board, additional resource has been provided to NHS Grampian to support its unscheduled care pathway work, and we will continue on a business case basis, on a needs-based and evidence-based basis, to consider any funding bids that would assist in supporting the improvement of services, both in Grampian or in any other board for which there is a service pressure.
Thank you very much.
Okay. Thank you very much indeed, colleagues, for those questions. I'm very grateful for them. That brings to a close the public session of NHS Grampian's annual review. I am incredibly grateful to everybody who has come from NHS Grampian, from community councils, from members of the public, patients and staff to contribute to what is a very important session. I have to say, contrary to Frank's assertion, it was not me that facilitated or organised this. There is a team within NHS Grampian and the Scottish Government that has done so, but it affords me the opportunity to thank them for their work in pulling this together and ensuring that a very important element of the public scrutiny of our boards is able to be done productively, efficiently and fully transparently in front of the public and media to ensure that the questions can be addressed and answered and there can be a scrutiny and accountability for the work that is done here. As I said at the outset, a letter setting out what has been discussed in each of the discussions that I held earlier on today and summarising what has been discussed here will be summarised over the coming period and published on the board's website for scrutiny and transparency purposes. But otherwise, it just leaves me to say thank you very much indeed for your participation and to the board for its work, and I hope you enjoy the rest of your day. Thank you very much. Bye-bye.